And I guess what we would say is that if you're not investing in our healthcare infrastructure, you're doing harm. And if you're going to pull away investment, that's even worse. So it's certainly concerning, the discussions that are going on at the federal level.
Hello and welcome back to The Perch from the Wyoming Tribune-Eagle. I'm Noah Zahn, your local government reporter here. This week we're sharing a conversation that our state government reporter Hannah Shields had with Josh Hans, who's the Wyoming Hospital Association vice president. As congressional lawmakers are considering an $880 billion cut to Medicaid, Wyoming healthcare experts are eyeing what cuts will be made in the process. One option could be allowing premium tax credits to expire, which would raise health insurance costs for tens of thousands of Wyomingites. Those premium tax credits are refundable tax credits designed to help eligible individuals with low or moderate income afford healthcare insurance to be purchased through the health insurance marketplace. Hannah spoke with Josh about how this could impact the state's hospitals, nursing homes, and healthcare prices on the marketplace. Here's that conversation now.
Appreciate you taking the time to talk with me today. But yeah, I was speaking with somebody from CRMC, and she forwarded me, looks like a news release that from the Wyoming Hospital Association and Leading Age Wyoming regarding Medicaid and Medicare in the state. And I think it also, I'm trying to see here, but it looks like it could be also like talking about some of the cuts, like what that would mean to the state. And I know that's kind of like a big discussion right now. Just like looking at the news, it looks like Congress has been considering making some pretty big cuts to this program. So I kind of wanted to follow up with you and kind of get an understanding, first of all, the background of this news release and why it's been sent out, and like kind of like what some of these internal discussions are going on here.
Yeah, so like you mentioned, Congress is talking about removing $880 billion from the parts of the budget that include Medicaid.
Yeah.
And so they've been floating a number of ideas. So those discussions are ongoing. The last I heard is that committees had until May 9th to make their recommendations. And so whether or not they hold to that, but that's sort of what their self-imposed deadline has been. And to get to that number, Medicaid would have to take a pretty big hit. And so it sounds like, they're seriously considering ratcheting down the federal match for the expansion populations. Now, Wyoming didn't expand Medicaid, right, so that wouldn't touch us. But that also doesn't get them to $880 billion. So what else are they going to do? So some of the things that we've heard about are around putting caps on what are known as provider taxes or upper payment limit or supplemental payment programs, of which Wyoming does participate in a few. And those are fairly complicated mechanisms, but essentially what it does is it helps draw down more federal dollars into healthcare for the state. Okay. And so, like, for example, nursing homes are a large benefactor of one of those programs in Wyoming. So, and our larger concern is that if you're looking at cutting Medicaid in any way, that would reduce the federal dollars flowing into our state. That is just going to further disrupt and harm our healthcare system across the state. We already have a lot of uninsured folks in the state. Medicaid, I think in Wyoming is like 60-something% is for the coverage of children. And then one of the other things that's really not more concerning, but is also concerning is that some of the subsidies that people are eligible for to purchase insurance on the marketplace are scheduled to go away at the end of 2025. And so we have, I think it's about 42,000 people who get their insurance in the state on the marketplace. Mm-hmm. And I think it's like 95%, but let me double check that. 96% receive an advanced premium tax credit.
Okay.
If those go away, what we anticipate will happen is that rates on the marketplace are going to jump dramatically. And what I would suspect would happen is people will just begin foregoing insurance. And so you're going to add to the uninsured rate in the state. And I believe it's the Kaiser Family Foundation had done a state-by-state analysis of what they expect. And they do a pretty in-depth analysis state-by-state of what they think some of these proposals will do, and including the premium tax credits expiring.
Okay.
And it's just, and I think you and I have talked in the past about how we already have struggling hospitals and nursing homes, and Medicaid is a lifeline for a lot of those facilities. And Medicare as well. I mean, Medicare and Medicaid together represent way over half of total revenue for our hospitals in the state. So, and I guess what we would say is that if you're not investing in our healthcare infrastructure, you're doing harm. And if you're going to pull away investment, that's even worse. So it's certainly concerning, the discussions that are going on at the federal level.
And I want to look into at this newsletter that was sent out from the Wyoming Hospital Association that I got.
Yeah.
There is a chart on the second page, or like a visual graphic, where it says value added impacts by county, and it has different numbers for each county. And in Laramie County, it says $615.15 million. So I was wondering if you could explain to me what these value added impacts are.
Essentially what that's measuring is, of all the inputs into, and this is for hospitals and nursing homes, like what is it returning to those communities? So that could be in wages, taxes paid, what they call, I think inducements is what I can find the language for you.
Okay.
But that's what it's measuring. And so, for example, if you removed hospitals and nursing homes from Laramie County and nothing else changed, right? You would see, if not all of that, most of that value add go away.
Okay, so this is
now,
like
that would be like the most extreme thing, right?
Sure.
But any reduction in what hospitals and nursing homes are contributing, like I said, through wages, taxes paid, things bought in the community in support of those operations, things like that, right?
Okay, yeah. So pretty huge economic value here provided by them that could be at risk. Another question, too, is I don't know if this particularly includes CRMC, but like you mentioned, we have spoken before about how some of our hospitals are doing across the state, how some of them are already operating in the red because they're eating up the costs of treating patients who are uninsured. And just kind of taking that in. I think just like looking at like these cuts, like how do we see this hurting our hospitals more? That might even be probably related to this premium tax credit if that were to expire this year.
Yeah, so that's going to absolutely hurt because you're going to add to the number of people who are uninsured.
Right.
And then when they come in the hospital without a pay source, then, hospitals eat that. And that's certainly one driver. Others are, the cost of doing business, right? Labor costs have gone up starting in COVID, and have risen significantly. Inflation that's hit the rest of the country. Hospitals are not immune to that. So what they pay for supplies and equipment has gone up. And then you have underpayments from Medicaid and Medicare. You have no payments from essentially no payments from people who are uninsured. You have commercial insurance companies who will deny claims or not pay the cost of the care. And, it's our industry is different from so many others because we don't get to decide what we get paid, and we have to serve everyone who comes in through the door. So, the environment's always been challenging, but it's become more so. And then, as we've talked about in the past, low volumes, places like Casper and Cheyenne certainly have a volume advantage over, places like Weston County, for example. But that still doesn't address all those other factors I just mentioned in terms of the cost of operating these facilities. And then on the nursing home side, Medicaid is almost the sole payer of patients that are in nursing homes. It's somewhere, if you take the whole state together, it's somewhere north of 70% of patients in nursing homes that are financed by Medicaid.
Got it. Okay, so I think just like two more questions for you, because I do understand, there is that, and I'm looking at a Politico article right now. So yeah, there is that May 9th deadline, it looks like, to get those plans finalized. So obviously we are not experts on what actually is going to happen in Congress, but do you think we'll have a better idea around early May what's going to happen with the Medicaid cuts and to the program, things like that?
Yeah, I think at least that day or around that day, we'll at least hear proposals out of committees in terms of what they want to do. So they'll still have to package them together, and it'll have to go for floor votes and things like that.
Yeah.
But I think we'll certainly have a better sense of what the committees are recommending.
Got it. So then my second question for you was, considering Wyoming and what we're focused on right now, what are some of the things that the Hospital Association is bracing for at this moment?
Is bracing for, you said?
Yeah, just I guess just like discussing, trying to get ahead of in regards to these discussions about potential Medicaid cuts at the federal level.
Yeah, so we, the association, are having conversations with our delegation in DC, and we're encouraging our members to reach out as well. And actually, that's the one pager, I guess 2-pager that you were sent. That was what it was created for, was to help our members have conversations with the delegation around protecting Medicaid and its role in Wyoming. Unfortunately, it's one of those, we're advocating on behalf of our hospitals. And like I said, at a minimum, I think we need to protect what we have if we're not investing in healthcare in the state. And so we just want to make that message very clear to our delegation that that's an important tool in Wyoming, Medicaid and Medicare for that matter. But it's something that we need to have be, predictable and reliable and strong, so that people who qualify can have that pay source, and so that our hospitals and nursing homes can continue to operate.
Because it sounds like, just like from a standpoint of what Wyoming has to lose outside of what's already stated in this, is I think that potential expiration date of these premium tax credits that could potentially lose tens of thousands of Wyomingites even more insurance.
Yeah, absolutely. I mean, you're gonna, if they go away, and it seems like they will, it's going to, it depends on your situation, but I mean, it could quadruple your annual premiums. And I just don't know who can take that kind of hit in their budgets.
Several news outlets recently reported that House Speaker Mike Johnson is ruling out major slashes to the $900 billion Medicaid program, and it's unclear what's still on the table. Wyoming U.S. Senators John Barrasso and Cynthia Lummis told Hannah this week that they're committed to eliminating fraud and abuse in the federal government. Barrasso said Medicaid cuts are unlikely to negatively impact Wyoming. Now, here's Taylor Staples to bring us a quick roundup of some of the events coming up in Cheyenne and Laramie County this week.
Today, May 9th, the Cheyenne Symphony Orchestra will host a classical conversation lunch and learn event from noon to 1 p.m. at the library. Also, the first day of the Cheyenne Home Show at Cheyenne Ice and Event Center kicks off today from noon to 6 p.m. The event will also run tomorrow from 10 a.m. to 5 p.m. and Sunday from 11 a.m. to 4 p.m. Another event at the library happening today is called Gamers Unite, where teens can play Mario Kart and Super Smash Bros. From 3 p.m. to 5 p.m. Today also marks the second weekend of Cheyenne Little Theater Players' production of Murder on the Orient Express. The show tonight will be at 7:30 p.m. at the Mary Godfrey Playhouse. Murder on the Orient Express will also play tomorrow at 7:30 p.m. and Sunday at 2 p.m. Then, on Saturday, May 10th, there will be a Master Gardener's annual plant sale at the Archer Event Center from 8 a.m. to 3 p.m., a Mother's Day craft and vendor show from 9 a.m. to 3 p.m. at 315 South Main Street in Burns, and a spring market at Gilchrist Elementary from 9 a.m. to 3 p.m. Also, the library is hosting a red and blue political workshop today at the library from 10 a.m. to 4:30 p.m. And at night, the final Cheyenne Symphony Orchestra concert of the season, Fortune and Glory, as well as the Cheyenne Chamber Singers' final concert of the year, Carmina, will commence at 7:30 p.m. at the Cheyenne Civic Center. On Sunday, May 11th, the Kenny Wayne Shepherd Band will perform with Bobby Rush at the Cheyenne Civic Center at 7 p.m. And on Monday, May 12th, the Cowgirls of the West have a lunch-in with speaker Mike Castle at 11:30 a.m. at Little America. Castle will speak on the Wyoming Stock Growers Association. Then, teens have their monthly Volunteens board meeting at the library at 4 p.m., and the Cheyenne Audubon Society is hosting a Birding 101 session from 6 to 7 p.m. at the library. Then, on Tuesday, May 13th, the Cheyenne Women's Connection is hosting their monthly meeting with speaker Silvana Aaron from Nebraska. She'll be talking about Pakistani history at the Red Lion from 9:30 to 11:30 a.m. Then, the Teen Art of Creativity Club will meet from 4 to 5 at the library. Also, there will be a sketchbook sessions for observational drawing hosted by Art Cheyenne at the Cheyenne Botanic Gardens from 5:30 to 7 p.m. On Wednesday, May 14th, the AARP Cheyenne Community Group will meet from 12:30 to 2 p.m. at the Laramie County Senior Center, where the South High School Band will perform. And the library will host a Healing Through Writing event from 5:30 to 7:30 p.m. for adults. And finally, on Thursday, May 15th, the VOA Northern Rockies will be at the library for an informational mental health session from noon to 1 p.m. Also, Thankful Thursdays has their second to last event of the season with the Wyoming Breast Cancer Initiative at the Lincoln Way Event Hall starting at 4 p.m. And finally, the library will be hosting a Sit, Stay, and Read to a Therapy Dog event from 4 to 5 p.m., as well as a card-making event for lonely individuals from 5:30 to 7:30 p.m.
Thank you for that, Taylor. And before we close out today, here's a quick recap of some of our top stories and headlines from the past week. A draft version of Laramie County School District 1's concealed carry policy was released for public comment during the district's board meeting Monday night. The policy will be available for review through June 20th at 4 p.m. The policy addresses Wyoming legislature's requirements, including training and curriculum requirements for employees and volunteers of LCSD1 who choose to carry a concealed firearm on school district property. Students are still not authorized to carry a firearm on school property regardless of their age and concealed carry status. Two separate topics drove a conversation about the extent to which the county government should play a role in the development of business in the county while also maintaining neighborhood values. This conversation was between county commissioners and was rooted in the proposed new Laramie County land use regulation laws, which is the law that outlines the set of rules established by a government that controls how land can be developed and used, dictating things like building size or type. Anticipated general fund revenues in the next city budget are up from the current fiscal year, but Cheyenne Mayor Patrick Collins said it's important to proceed with a fiscally conservative budget after the state legislature passed more laws lowering property taxes for most Wyoming homeowners. The projected general fund revenues for the fiscal year 2025, which begin on July 1st, are just over $74 million, which is up nearly $3 million from last fiscal year. And finally, the Laramie County Jail can now house federal inmates per a recently approved contract with the U.S. Marshal Service. The contract was approved in February, but the jail only accepted its first federal inmate last week. The intergovernmental agreement allows the U.S. Marshals to essentially rent 6 cells for federal inmates at a rate of $120 per day for adults and $190 a day for juveniles, the funds for which, as of now, will go back to the county. That's all for this week's episode of The Perch. Thank you for tuning in, and be sure to check back next Friday for more.